Hey everyone, my name is Alberto and I'm going to be presenting on behalf of my group. We're group 14 and it's going to be myself and Roxana. So here's a little introduction to joints. A joint is an articulation between two bones. Joints tend to provide movement and stability. There's a pretty clear trade-off between the two. As you increase stability, movement will decrease, and if movement increases, stability will decrease. There are two main types of joints. Synarthrosis joints allow little to no movement, and diarthrosis joints allow relative movement. Our report covered the skull joint, which is a synarthrosis joint. It's a collection of various individual fibrous sutures, and when we consider that trade-off I just mentioned, we can see that the skull joint is very stable, but it's immobile. So what are diarthrosis joints? Those are going to be our movable joints. They have four major characteristics: a fibrous capsule, a joint cavity, are lined by the smooth and oily synovial membrane, and hyaline or joint cartilage that covers the articular heads and joint cavity. Here we can see the types of diarthrosis joints. We have the pivot joints, the ball and socket joints, hinge joints, ellipsoid condyloid joints, and the universal saddle joints. So what about synarthrosis joints? Synarthrosis or fibrous joints are immobile or minimally mobile joints. Their main job is to be a source of high stability. These types of joints include serrate joints, scarf squamous joints, butt joints, and peg and socket joints. As for our methods, being virtual makes things a little bit harder, but this is how my group performed this. We divided up the different joints, we stood up and moved our joints to observe the range of motion, we determined the degrees of freedom based on the directions we could move a joint, we added that info to our Google Doc, and then verified our results by performing the movements our partner had just attempted. We estimated the angles for which our joints could move, and found that these angles tend to vary from person to person. Flexibility plays a major role here. These are our results. So we found that for the wrist, particularly the thumb is what we were looking at, it has 2 degrees of freedom, and so it's moving in a 0 to 60 degree motion range for adduction abduction, and a 0 to 120 degree range for elevation depression. The elbow has 1 degree of freedom, and it has a 0 to 140 degree motion range in elevation and depression. The shoulder, which is a ball and socket joint, has 3 degrees of freedom, as we would expect, and so it has a 0 to 180 degree motion range in rotation, a 0 to 200 degree motion range in adduction abduction, and a 0 to 270 degree motion range in elevation depression. The hip, another ball and socket joint, has a 0 to 90 degree rotation motion range, a 0 to 120 degree adduction abduction range, and a 0 to 200 degree elevation depression range. The knee, we only found 1 degree of freedom for, and that has a 0 to 170 degree elevation depression range. And the ankle, we found 2 degrees of freedom. So a 0 to 60 degree motion range in adduction abduction, and a 0 to 90 degree motion range in elevation depression. As for our joint, we found some important muscles that are involved in facial expression and movement. So the orbiculus oculi promotes the ability to blink, squint, and draw the eyebrows inferiorly. The corrugator supercilii draws eyebrows inferiorly and medially. The levator labii superioris raises furrows and opens the lips. The zygomaticus major and minor raises the lateral corners of the mouth upward, often to produce a smile. The risorius draws the corners of the lip laterally and tenses the lip. The depressor anguli oris is the antagonist for the zygomaticus, so it draws the corners of the mouth downward and laterally. And the depressor labii inferioris draws the lower lip inferiorly. But if the skull joint isn't moving, what does it actually do? Well, it operates as a stability attachment point for the muscles and as a protective cavity for our brains. It welds together our skull bones and makes this strong, stable structure that can withstand daily trauma and minimize impacts to avoid any damage to the delicate tissues of the brain. In our discussion, we were asked to compare the joints. So we compared the hip, shoulder, elbow, and knee. As you can see, the hip has 3 degrees of freedom and the listed ranges that we had mentioned earlier. The shoulder has 3 degrees of freedom, again, the listed ranges. The elbow has 1 degree of freedom, and the knee has 1 degree of freedom. As you can see, the shoulder has more movement, larger movement range than the hip. And as for the forelimb and hind limb, the forelimb has 7 degrees of freedom, whereas the hind limb we found 6 degrees of freedom. And the forelimb is going to be our arm, the hind limb is going to be our leg. So when we compare the two, we found that the forelimb has the 7 degrees of freedom and the hind limb has 6. And the reason for that is the shoulder joint is a ball and socket joint just like the hip, but it's a lot more shallow in the articulating socket. This means that it's held in place with more ligaments and is less restricted by bones, giving the joint a little bit more mobility. We also need to take into account that the hip needs to be more stable as it bears weight, so it will have a decrease in motility range. This also means that the shoulder has a higher likelihood of being damaged since it has more mobility but less stability. And if we take into account how much weight our legs are actually bearing, they're bearing a higher amount of weight than our arm. Our arm is kind of just dangling there. And these here are going to be our references. Thank you.